Hi class, this is Lauren, and for our health educator interview, I did an interview over the phone with a lady by the name of Ruth Clare. So a little bit about Ruth. She is a registered nurse at Central Peninsula General Hospital, and also she is a health educator. She works primarily with diabetes education and also does a little bit of work with cardiac rehab. But her main job with the diabetes education is open to those who are either at risk or who currently have diabetes. Another cool thing that she told me is that the program that she has is open to also family members and caregivers, so they can also get the education and training in diabetes as well. So the program called Living Well with Diabetes is the one that Ruth runs, and she's able to connect with individual patients on both a private and a community setting. So she has individual appointments, and then they also hold support groups. In addition to just the meetings, she also organizes an exercise class for people with diabetes to help keep it under control or potentially prevent diabetes from occurring. So it's a supervised exercise class that's personalized to fit each member's specific needs and abilities. When I asked Ruth about some of the challenges that she faces, she said that communication was the biggest one. So just figuring out how to communicate with each member on an individual basis can be really difficult because what works for one person might not work for the other person, and each patient is at a different level as far as knowledge goes and then as far as motivation and willingness to change. And so she said typically that's the most challenging part, but once she can kind of figure out where each patient is at, things seem to move a little bit quicker. She also noted that the program that she does meets the standards set by the American Diabetes Association for diabetes self-management education. When I asked Ruth about any advice she would have for a health educator, she said she really recommends being educated on an additional health career background. So like in her case, she's a registered nurse as well as a health educator. She said that this really gives her the knowledge base to be able to explain physiologically what the health implications are, and in turn then patients are able to relate a little bit easier and change behaviors when they're fully aware of the risks. Another thing that she just mentioned was to just be open-minded and aware and sensitive of where each person is coming from and where they're at. As far as the health models that we've learned in class, when I was talking to Ruth, she said she didn't have one that she specifically uses, but the more we got to talking about it, she said that the health belief model was the one that she was the most familiar with, which has the 6 constructs, and her diabetes education program is kind of based around those. So with the health belief model, like we learned, it's for problems that can be avoided or cured by taking a health-related action. So it focuses on meeting each patient and then walking them through each step to eventually get them to be able to maintain their health on their own, which is one of the main things with the Living with Diabetes program that Ruth has. So I really enjoyed getting to talk with Ruth a little bit and just learn about what she does on a day-to-day basis. So thanks guys, and I hope you enjoyed the presentation.